And new tonight, a much anticipated Washington State Board of Health meeting was less eventful than many people had feared. The board heard a proposed rule that was intended to change the way the state handles people living with HIV. Officials say they tried broadening the interpretation of the law so that it's not specifically targeting people with one specific disease. They say the part of the law talking about quarantine and isolation actually isn't new.
WAC 246-100, 040, and 045 have been were adopted in 2003 and have not been amended since that time, and they're not open for consideration today.
I mean, it follows due process, and so I think any concerns that this would not follow due process is laid out very clearly by statutes.
Now, board members also got an update on the process to determine if the COVID vaccine should be required for children in Washington schools. The board vice president says there is a long way to go before that decision is made.
The other reassurance I want to give to the public is that there have been recommendations for vaccines in the near past that were turned down. For instance, we do not require meningococcal vaccine for every student who enters K-12. So this is an open process in that we're really looking at the science and how that leads us to say what is the protection.
During more than an hour of public comment today, board members heard concerns about the vaccine and the possibility of making it mandatory. None of the comments today were in favor of requiring the vaccine.